Hi, I'm Anna Galetli again, and we're going to continue on with our Unit 7 discussions, and we're going to be looking a little bit more closely at joint structure and the structure of the knee. All right, so the majority of the slides in this particular PowerPoint deck are my notes that I have organized to give to everyone. That shows my definitions and the things that I am emphasizing. I'm not going to read these to you. That would be really boring for you and for me. Instead, we're going to go and I'm going to talk specifically about the pictures, and I'm going to apply these terms to that. So if you have not gone through and read all of the PowerPoint deck and all the slides, I recommend that you pause the video and you go through and do that first. All right, so we're going to look at some pictures of joints that are being classified by structure. So the first set is going to be our fibrous joints, and we're going to look at some syndesmoses and some sutures. Remember that when you're looking at these, think about the name. You want to focus on the fact that they're fibrous, so they're made out of a dense regular CT, no joint cavity, are synarthrotic, etc. All right, so if you come up here to your skull, all right, you will see these areas right here. And you'll remember, or you'll eventually get to the fact that this is made out of a dense fibrous connective tissue. And this is where we have these really thick areas that are going to be ossified via intramembranous ossification. That should be familiar to you. As we grow, these sutures begin to become less wide and full of less connective tissue, and eventually they can actually seal up completely, okay? But the only place where you're going to find these sutures are up in your skull, okay? And then down here we have a syndesmosis. So here's an example of a syndesmosis between the fibula and the tibia. To me, it kind of looks like a spider's, so spider web, no, not web, spider egg case. That's what it reminds me of. All right. Both the suture and the syndesmosis, their goal is to not have movement. So they're basically synarthrotic, although you can get a millimeter or so of flex in those areas. All right, cartilaginous joints, focus on the name. We're talking about cartilage. All right, so basically you're either going to have hyaline, or where did I write down hyaline, or you can have a fibrocartilage with hyaline, okay? Some of these are synarthrotic, some of them are amphiarthrotic. It depends on what you are looking at, so you're just going to have to memorize that part. But basically these are not like major moving joints, but they have, some of them have a little bit more flexibility than others. All right, so here is an example of a specific type of cartilaginous joints. You'll notice the name synchondro, so with cartilage. This particular example is costal cartilage, and you can see how it's attaching the rib and the sternum together, okay? And this is a good thing to have cartilage here because it gives you more flexibility because the cartilage can bend a little bit. As we age, some of our elders, like really old, we're looking at 70s, 80s, 90s, this stuff can start to ossify and become bony. And what you want to remember, they are made out of hyaline cartilage. The epiphyseal plate is another place where we use hyaline cartilage. This really should be synarthrotic here, okay? Whereas up here, I would call this more ampy because it can bend a little bit. You don't really have movement here and here, but you've got flex in the middle. Not really moving. Oh, my terrible handwriting. That does pull. If you ever look at bone that's had all the cartilage right away, you'll notice that there's been pulling in between. And they use that actually as a way of trying to age skeletons. It's not a very accurate way, but it is one method that we use for aging skeletons. All right, coming back down here to the epiphyseal plate, made out of, again, hyaline cartilage. And that's where we grow our bones in length, and it should be synarthrotic. If it's not, you're pulling on this stuff and you're going to get an area of scar tissue, and then you're not going to have growth. All right, next slide. All right, symphyses are seriously cool because they have two kinds of cartilage present. You're going to have hyaline cartilage and you're going to have fibrocartilage. So the hyaline cartilage is going to coat the ends of the bones, whereas the fibrocartilage is going to tie them together. All right, this picture at the top is showing a symphysis at the vertebrae. It's not a very good picture. The way the fibrocar is hard to show. So right here, we're going to show in red where you've got the hyaline cartilage coating the edges of the bone. But then let's switch to a color. What the fibrocartilage is, it'll actually, so if we look at this on end, I'm going to have hyaline cartilage here, all right? And then I'm going to take fibrocartilage and wrap it around here. And then I'm also going to have some fibrocartilage around in there, okay? And then down here at the bottom, at the pelvis, all right, we're looking at our pubic symphysis. It's nice because the name has the fact that it's a symphysis type of joint. So again, we would have hyaline cartilage on the surfaces of the bone, but then we take the fibrocartilage and we tie those two bones together. And in fact, this stuff is so tough that I couldn't cut through it with 10 snips. I had to get out a bone saw. So it is super tough. All right, let's look at our basic structure of the synovial joints. So what we've been looking at before have not been synovial. We've been looking at the fibrous and the cartilaginous. The synovial are probably the joints that you think of when you think of a joint because they are fully movable. So the word we use to describe the fact that they move is diarthrotic, so two-way, basically two-way for the joint, although some can go in multiple directions. So we're going to have a proper joint capsule with a synovial membrane filled with synovial fluid. You have an articular capsule surrounding ligaments. And let's go on to the next slide. All right, here's the slide I wanted where it had everything labeled. The previous couple of slides have the definitions of all of these structures, but let's just go through them together. So right here we're looking, this is just some generic bone. It kind of looks to me like two little finger bones, all right? You can see a remnant up the epiphyseal line right here. Medullary cavity, cortical bone, spongy bone. This is the epiphysis, that would be the diaphysis. So you'll remember from when we studied the structure earlier, you have periosteum, which is a fibrous CT coating the outside of the bone. And I want you to notice it's thin right here, and then we're going to come down to here. Notice it suddenly starts to get thicker, all right? That is forming the fibrous capsule of your articular capsule. So right here, that is the fibrous capsule of the articular capsule, and then right here, that's P for periosteum, okay? Then, and this is what the body does, is it does a lot of continual, gradual transitions from one area to another. So it goes fibrous capsule, then it gets thinner again, and it becomes the periosteum, okay? Now, the inner lining of the articular capsule is done in green, and that is the synovial membrane, okay? And this is going to be very similar to a serous membrane or a serosa, okay? And that you're going to have epithelium plus connective tissue proper, usually areolar, and it's going to be secreting a fluid. In this case, we're going to call it synovial fluid. All right, the synovial fluid provides a medium for transport, so it allows things to move from one side to the other, so like gases, nutrients, that kinds of stuff. But it also forms a cushion, helps with compression so that you don't rub the bones against each other, okay? So there's a couple of functions. So you see that, we'll get out green, all right? So that's the synovial membrane in green. And then you'll notice that the synovial membrane right here is going to transition in color again, and all of a sudden it's blue again. All right, that is your hyaline cartilage right here. Okay, and so we've got some more of it right there. Now, actually, let's draw an arrow, okay? So articular cartilage is made out of hyaline cartilage, and it's going to coat the ends of the bone, okay? So then you've got bone and bone. You've got the entire articular capsule composed of the fibrous and the synovial membrane. And then surrounding all of that, you're going to have your extracapsular ligaments going around it, okay? And these ligaments, so extracapsular, so extra, not part of, outside of the articular capsule, okay? So it's outside of that, and it helps to stabilize this joint, okay? And then if you continue to layer things up, which we don't have on here, you would have a layer of muscle, which helps to further stabilize that joint. All right, let's move on. All right, so wherever you've got movement in the body, you have problems with friction, rubbing, heat. These are all places where you can get injury. So one of the things your body does is it inserts bursa and tendon sheaths, okay? So right here, I've got bone and I've got bone, and then I have a ligament. Here I've got a ligament. Now, when things move, these areas, I've got muscles in here as well, and they're going to be moving against each other. So I take a little bag of fluid called a bursa, and I stick it in there between two areas where there's the potential for friction, and that helps to reduce the friction. So it's kind of like when you wear shoes and you wear your shoes without socks, you're more likely to get a blister. But if you put socks on, well, then the socks form like a bursa-like structure that protects your skin from the friction from the shoe, so you don't get a blister, okay? Now, right here, we see the tendon for the biceps brachii muscle, and this is going through a tube of bone and ligament, lots and lots of rubbing. So we actually take the bursa and we wrap around it like a tube sock. And when we do that, we call it a tendon sheath, okay? We use these bursas and tendon sheaths throughout the body, all over the place. They're very important. You're going to find them in all of your joints, okay? Now, you may have heard of people complaining of bursitis. All right, bursitis is when you get inflammation in this area, usually due to repetitive motion, repetitive use, like tennis elbow, bursitis in your knee, and basically it gets rubbed too much and it gets swollen and the fluid builds up in it. Okay, and the only real treatment for that is to stop using the joint and let it heal. All right, so I just skipped a couple of slides about joint movement. You should definitely look at that. There's another video that demonstrates some of these movements. All of that information is testable, so please look at it. We're going to look at the knee now. All right, and this slide, and I think the next one, has all the definitions of the different structures. So let's go ahead and look for a picture. All right, so now we're looking at the knee, and what you should notice is we've got our femur labeled, the tibia labeled, and the patella labeled, okay? Then what you're going to see is up here, all right, this is where you're going to have the articular capsule. They're not really showing it very effectively on the anterior side. Over here on the back side, you see better the fibrous capsule of the articular capsule. So we can write that in to clarify that that is the fibrous part, okay? And then the synovial part is right there. So that's the synovial membrane in green. All right, so you can see it right here, and then you can see that it's right up here as well, and then there's a remnant of it down in here. We have other things done in green right here and right here. And those are actually, whoops, that's not what I wanted. Those are bursa, okay? So coming back over here, So you have the synovial membrane in green, and then right here I have the articular cartilage, all right, which is also sometimes called hyaline cartilage. And you'll notice you have it on the femur, you have it on the patella, and you have it on the tibia. So that's helping with the compression and movement. The synovial fluid in the middle is also helping with compression, and it also helps to transmit gases and stuff so that all of these tissues that don't have a blood supply directly can get blood, okay? Then, pick another color. Right here, we see the cut edges of the half-moon-shaped meniscus, okay? Memorize the definition. Absorbs extreme shock. So this is the pounding of the femur against the tibia. And it also, when your knee is locked, it prevents side-to-side rocking so that you don't blow out your knee when you're standing upright. Okay? What else do we have on here? So we had the patella right here. I don't like that color. And then you see the quadriceps tendon. And this tendon wraps around the patella, and then it's going to come out right here, and it's going to insert on a bony feature that you should have learned called the tibial tuberosity. Now right here, notice that I've changed the name to patellar ligament or patellar tendon. Technically, you can use either term with me. I don't care. It's called a ligament because you're going from bone to bone, okay? But technically, when you look at this histologically, it's a tendon when you look at the structure of the tissue. So it's more like the tendon has wrapped around a bone and insert on the tibial tuberosity. Okay, so that's why I've used both of those terms there. All right, let's go on to more pictures. All right, so in this picture, we've got an anterior view of the knee, and you've got your tibia, you've got your fibula, you've got the patella. Deep in here, you've got the femur. You can see a little bit of femur here and a little bit here on the condyles, okay? What we're really focusing on is the movement of the ligaments and tendons. So we've got the quadriceps muscle up here, and you can see the quadriceps tendon, and it's wrapping the fibers around the patella, and then it's coming down as the patellar tendon and inserting on the tibial tuberosity, okay? Then off to the sides, you've got a lot of structures, you've got a lot of tricks that your body is using to try and stabilize the knee joint, because really your knee joint is the dumbest joint in the entire body. It's got all this weight on it and it's flat. So it's not a very stable joint. So for bipedalism, we've done a lot of things to try and stabilize this essentially horrible joint. Two cute ligaments right over here. We've got the medial and lateral collateral ligaments. If you can't remember medial and lateral, use tibial and fibular because, well, they go, this is the fibula and this is the tibia. So they go together, and that might help you remember it better. Either way, it's fine with me, whether you call it medial collateral or tibial collateral. And then you have right here the retinacula. So you got the medial patellar retinaculum and the lateral patellar retinaculum. And then there's more, but this is just a subset of the most important of the extracapsular ligaments. All right, so now let's take a peek at the intracapsular, so inside the articular capsule ligaments. You got two that are really important, and I'm sure you've heard of them. The ACL, which stands for anterior cruciate ligament, and the PCL, which stands for posterior cruciate ligament. All right, and you'll notice the structure. They're going from anterior to posterior and posterior to anterior. And they actually form little bony ridges on the patella, on the tibia and the femur where they attach. You can see the two meniscus here, the lateral meniscus and the medial. Let's do different colors. So medial meniscus in red, lateral meniscus in blue. Those are made primarily out of fibrocartilage. All right, and the reason we use fibrocartilage there instead of just leaving it hyaline cartilage like we do up here on the femur, that's just hyaline, and this is just hyaline. We use the fibrocartilage because every time you take a step, you pound down. Ooh, that's an awful P. Pound down on that tibia. So you want a more dense cushion, and so you add more fibers to make a denser cushion so that you don't trash your tibia every time you take a step. Notice the cup-like shape right here that matches the cup shape of the femoral condyles, so that when the femoral condyles lock into these, when you're standing upright, these lips hold it in place so you don't get side-to-side rocking, okay? What else? On the cruciate ligaments, they're preventing front to back displacement, and also to a certain extent twisting, and I've got another slide to demonstrate that. All right, so now we can look at what functionally the posterior and anterior cruciate ligaments are doing. So let's look at the anterior cruciate ligament. So their job is to prevent dislocation of the tibia. Notice that I'm writing it on the tibia, okay? So they want to prevent it from either going anteriorly or posteriorly. So I want you to focus on the name. Anterior cruciate prevents anterior movement of the tibia, okay? So that's why I have this arrow here. What it's doing is it's trying to prevent the tibia from sliding forward and dislocating out of the joint. So basically, this is, so you've got an anchor here, and you've got an anchor there, all right? And this is keeping that from sliding forward, okay? Now, the posterior cruciate, it does the exact opposite. Posterior restricts the posterior movement of the tibia. So it's preventing the tibia from sliding backwards and popping up over here. So anterior prevents it from going this way, posterior prevents it from going that way, okay? All right, so here's an X-ray, and I like X-rays, so we're just gonna look at it real quick. So I have femur, I have tibia, and I have fibula. What I want you to notice is this nice gap in here. That's where your meniscus is, and it's a soft tissue, so it doesn't show up in the X-ray. And then right here, look at these little bumps. Remember I was talking about the ACL and the PCL? So those two ligaments are pulling on the bone there, creating those two bumps, okay? Now over here on the other side, so drawing a line. So here's your patella, femur, tibia, fibula, and you can see the gap right here, all right, where you're going to have muscle and tendon, and then you're going to have synovial fluid in here, and then all in here is fluid, and then the joint capsule, and you can kind of see how it goes together, okay? So that was the end on your knee joint, and let me know if you have any questions.